So we're going to be talking about the type of stroke to use and how to adapt the Explorer to the tooth so that we can do assessment strokes. We use assessment strokes, which are very light grasp and very feather-like strokes when we are assessing if there is any calculus on the tooth. So we're going to, again, place the tip of our instrument on the tooth we want to work on. For anterior teeth, we determine if it's parallel, so we're looking at that terminal shank again. It's parallel with the long axis of the tooth. And we're going to activate our instrument. We're not going to activate our instrument while it's on the tip. This is going to scratch the enamel surface. We want to turn the tip of the instrument in the direction that we want to move. So I'm sitting at 8 o'clock here to do toward surfaces. So these are toward, toward, toward. And I'm going to turn my instrument on its side so that it's on the tip third side of the tip and start a little bit behind the midline so that I overlap this when I come back and do the away surface. I want to overlap our midlines and our distal line angles all the time. Okay, so for number 10 here, I'm going to start behind the midline, turning it on the side of the tip, and I'm going to slowly start walking. I'm going to go up underneath the gingiva. You're going to see the tissue turn white. That is called blanching the tissue, and it means that I'm up underneath the gum line. And every stroke that you take, you want to turn the instrument a little bit more. We're always adapting the side of the tip to the tooth. We're going to go up underneath the contact. So underneath the contact means I shouldn't be able to pull this tip out through the teeth. So I'm up underneath where these two teeth meet. That's where calculus likes to hide out. I'm going to turn the tip inward of the tooth, so I hug the surface of the tooth. It'll really let you feel if there's anything on that proximal surface. I'm going to do several strokes here. Up and down, up and down, up and down. Coming back to number 11, we're going to start before the midline and walk, walk, walk up underneath that contact and do several strokes. For posterior teeth, we're going to use that same method to determine the proper end. I'm sorry, I probably should let's do the away surfaces first of anterior. Okay, so still staying on anterior teeth, I'm going to do the away surfaces. I'm going to move to about 11 or 12 o'clock, starting behind the midline so that I overlap it, turning on the side of the tip, and walk, 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 turn, 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 up underneath that contact and do several assessment strokes. Okay, that is anterior teeth. Now, posterior teeth. I'm going to have the patient turn towards you. I'm going to be sitting at 10 to 11 o'clock to do away surfaces here. If I go to number 14, again, placing the tip of the instrument on the distal surface to determine if we have the correct working end. That is parallel. So I'm going to start at the distal line angle. The distal line angle is about the corner of the tooth. If you're picturing your molars and premolars as a square, it's like the corner of the tooth right here. I'm going to start here and turn our instrument so that it'll walk into the distal, blanching the tissue as we go. Walk, walk, walk into the distal. And you still want to turn that tip into the tooth. You want to feel that whole proximal surface. Coming back out, we turn our instrument so that the tip of the instrument is going to walk to the mesial surface. You always point the tip in the direction that you want to walk. So I'm going to insert back at that distal line angle, so I overlap that area. Calculus loves to sit right here. We're going to go underneath the gum line and walk our way across the mesial surface. Right on into the mesial contact, turning that tip inward and feeling that proximal surface. Same thing back here. Hug that corner of the tooth and walk right in. Several assessment strokes here. Come out, turn, and walk to the mesial.